Hi guys, Doc Chris here. Welcome to the Scrubby MD and the Doctor's Order podcast. Welcome to another episode. So today, medyo kwan na din. And I think it's upon recording. This is a Friday, and I want to add another health tip sa mga patients namin, especially sa mga patients sa family medicine clinic, on how to use or properly use their electronic blood pressure monitor or yung electronic BP app. Okay? Marami na kasi nabibiling ganun ngayon. Okay? Marami na nabibili sa Shopee, sa Lazada, and hindi lahat yun ay grade A or kumbaga high quality. So always remember na dapat bumili kayo dun sa may quality may standard, may mga particular electronic devices na pumapasa sa standard of using a kumbaga medically graded na electronic BP app. So always check kung ano yung binibili nyo. Better buy a BP app sa isang pharmacy para at least makikita nyo, ma-check nyo dun sa store mismo kung de kalidad ba yung BP app na bibili nyo. Nonetheless, marami naman kasi nabibili sa online. Make sure na maganda yung reviews, saka hindi siya scam or hindi siya fake, kumbaga, no? Sa topic natin kasi, one of the most common illnesses na nakikita sa mga patients sa family medicine clinic ay ang hypertension. So, hypertension, marami kasing pwedeng idulot itong sakit na to. So, pwedeng mag-cause ng blindness kasi hypertensive retinopathy, pwedeng mag-cause ng stroke, pwedeng mag-cause ng heart attack, pwedeng mag-cause ng renal at saka liver failure, and pwede rin, syempre, mag-cause ng peripheral vascular conditions or problems, pwedeng mag-cause ng CVI or mga varicosities or limb stroke, yung mga ma-stroke ng mga parte ng katawan kagaya ng kamay, ng paa, kung hindi na control ang blood pressure. So, ano ba yung mga kasama na risk factors kung hindi mabantayan ang elevated blood pressure? So, mga risk factors din, syempre, yung lifestyle ng isang tao. Kung let's say yung lifestyle niya, marami siyang bisyo, kailangan din i-correct yun. Lalo na kapag nakita siya sa first consult niya sa family medicine clinic or sa isang primary care clinic. We need to correct yung mga lifestyle changes or lifestyle problems niya ahead of time. Like quitting smoking, quit smoking rather, limiting the amount of alcohol, and then encouraging exercise, tsaka correct diet ng patients. Now, ang topic naman today, hindi naman entirely lifestyle, no? Yung pag-check lang ng BP. So, punta tayo sa main topic natin. May picture ako na nakuha from the American Heart Association on the proper use of your electronic blood pressure cuff monitor. So, ito yung image. So, pag nakita nyo dito sa image na to, may mga kailangan na rules bago ka mag-check ng BP. Okay? So, yung BP, una, pag napansin nyo sa BP apparatus, sabi doon is validated. Sabi ko kanina, mas better na makita mo yung machine mismo bago mo siya bilhin. Okay? Better bilhin mo na lang sa pharmacy para mayroon kang ma-inspect. Okay? So, what should be the prerequisite? So, prerequisite meaning yung environment, dapat ganito, yung katawan mo condition for BP monitor, BP checking, okay? And syempre, anong time of the day, kadalasan ginagawa ito. So, check mo dito sa unang part sa taas. So, kung napapansin nyo sa arrow ko ito, it should be in a quiet room, comfortable temperature. Okay? Sa Pilipinas, hindi natin masabi yung comfortable temperature kasi may tendencies na sobrang init kagaya dito sa Tugigaraw, no? Or sobrang lamig naman kagaya sa Baguio, di ba? Quiet room, pwede yan, pagising sa umaga. Next, hindi ka pa nakasigarilyo, kung naninigarilyo ka. Pero I advise quit smoking, guys. Okay, wala pang kape, wala pang exercise. Meaning, kung wala pa yung mga yan, the most effective time of the day para dito sa pag-check ng BP is pagising sa umaga. Wala ka pang nahawakan. And unless you're the smoker na pagising sa umaga, unang hinanap mo, sigarilyo. Which is, syempre, very bad. Okay, a very bad habit. Next, empty ang bladder. Now, tendencies kasi pag empty bladder, less yung pressure or less yung parang nagtitimpi ka. So, as much as possible, walang kakatapos mong umihi. Okay, relax yung katawan. Speaking of relaxed, you should be relaxed for at least 3 to 5 minutes in a seated position with a back support. Okay? Take 3 measurements in 1 minute interval. Now, kagaya, ine-emphasize ko sa mga patients namin to, yung mag-check ka at least 3 times in between 1 minute. Kasi, we need to get the average. Average meaning kung i-add mo yung upper number na 3, tapos divided by 3, tapos i-add mo yung lower value na 3 divided by 3 to get your average. Okay? To get your average blood pressure. Now, wag mong gawin yung sabay-sabay. Dapat may interval ka. Okay? Now, kaya sabi ko kanina, relaxed. There must be a back support. Okay? Hindi ka nagsasalita, kagaya ng ginagawa ko. No talking during between measurements. Cuff to fit the arm. So, the size of the cuff is usually small, usual, normal size, and large. Merong size yan based on the length of your arm. Okay, kadalasan sa Philippines, you usually get the normal size yung default. Yung large kasi sa mga Americans, small, siyempre mga petite na individuals. Okay? The arm should be rested in a table. Okay, mid-arm level, at the level of the heart. Kadalasan yung cuff. Okay? So, yung resting face niya. So, dito sa area na to, kagaya sa picture, dapat kung saan yung cuff, nandun, meron kang naka-rest. Level at the heart. Okay? Feet flat on the floor. Okay? So, you do your measurements 3 times in 1 minute interval, rested. Okay, without any stimulant, smoking, coffee, exercise after 30 minutes. Once you get your average, that is your blood pressure. Now, siguro tatanungin niyo, Doc Chris, paano naman kapag wala akong electronic? Paano yon? Well, you could always use your sphygmomanometer. Okay? Lalo na kung may kakilala kayo or kapitbahay na nurse or healthcare provider na pwedeng mag-check ng BP mo. Okay? For manual auscultatory devices, the inflatable bladder of the cuff must cover 75 to 100%. This pertains to yung cuff. Okay? And, well, unfortunately, kapag kasi yung device is yung auscultatory, there are tendencies na medyo subjective siya sa reader. Pero most of the time, magkakapareho naman kami ng reading. Okay? Just as long as you're reading it correctly, makukuha mo yung tamang blood pressure mo. And, mga unang panahon naman, aneroid sphygmomanometer pa rin naman ang ginagamit natin. So, it's also reliable. Actually, it's equally reliable. Okay, the aneroid at saka sa electronic. Now, what device should be avoided nowadays? Syempre, if you're still using what we call the mercurial, okay, sphygmomanometer, na may mercury na tumataas. If ever napansin yung mga yon sa clinics, okay, well, they're already, kumbaga, iniiwasan na gamitin because of the risk of it to break. Pag nabasag yon, the mercury would leak, and then if ever na-absorb yun ng skin, sino man ang malapit, pwedeng mag-cause ng poisoning sa skin. Okay? So, in that instance, you should always be safe, no? Better use an aneroid or an electronic sphygmomanometer. Okay? So, yun lang naman ang proper checking of your blood pressure. And then once you check your blood pressure, you record it in your notebook. Sa mga hypertensive patients namin, kadalasan, we're advising them to have a BP diary. So, during the checkup or the follow-up checkup with their patient or with their primary physicians, ipapakita nila yung BP diary para ma-check namin kung tama, maganda ba yung blood pressure nila for the past 30 days. And then if kailangan bang i-adjust or kailangan bang increase or i-lower yung mga doses natin to meet a desirable blood pressure. Now, kagaya dun sa mga ibang karamdaman, di lang naman kasi gamot ang magiging basis natin for a better or a healthier life. Syempre, we encourage lifestyle change. Number 1, exercise. Number 2, correcting the diet. Number 3, taking the medication. Number 4, syempre, yung participation ng patient and the family. Okay? So, yun lang naman for our hypertension and how to measure your blood pressure using a validated electronic BP app or even an auscultatory aneroid sphygmomanometer. If there are any questions regarding dito, you could message me directly or you could post it on the comments so that I could answer them on my free time. Okay? So, hanggang doon lang naman yung video ko. Medyo simple lang. Ayoko na masyadong isipin kung ano ba yung mga pwedeng complications. Pero wala naman di. Kailangan lang naman you do your part as the patient to monitor your BP. Okay? So, wait lang. Uy. So that wraps up my video and hopefully may natutunan kayo, especially to our hypertensive patients. So this is Doc Chris, the Scrubby MD, and thank you for joining me, the Doctor's Order podcast, and hope to see you on the next video. Bye-bye!